been cool to watch her and her journey, just like from the time where she first started sketching, and now she's doing all these portraits of family members and things like that. It's really cool. So, but anyways, we're live. We're gonna talk about some fun stuff today. I'm with Stacey, PA again.
Good morning.
The PA is for physician's assistant, but you're so much more than that, I think. Like, you have over 2 decades of helping people in the health space, and so I'm gonna call you doctor. Is that cool?
You can, yeah. So when I'm in practicing, we're not allowed to say that, but
Yes.
it's a podcast.
Yeah, I'll call you Doc. What's up, Doc? So, we got a lot of great feedback on the last pod, the first and last, and hold on, this is the next, but, and we just barely scratched the surface on health and the medical system. And hi, dog. Oh, what's your dog's name?
This is Nala.
Hi, Nala.
She's 1, so she's needy of attention all the time.
Well,
yeah.
We're all dog lovers, and if you're not dog lovers, then we're cat lovers too, and we love cows. Or just
nice.
Anyways, so yeah, we barely scratched the surface on health and women's health, hormones, weight loss, and I really want to do a deep dive into like a hot topic, and I kind of say that loosely because a lot of people don't want to talk about it. It's kind of like one of those especially as a guy. Like, I mean, I'm told, like, I kind of got used to talking about it because I was helping patients and clients that were going through it. So I was kind of thrown into it. And at this point, you're like, oh gosh, what are you guys going to talk about? Because I'm not even saying what we're going to talk about. So we're going to talk about menopause. And it is one of those, where it's not so fun. It's not a fun time, would you say? No,
it's not a fun time.
It's not a fun time.
When you get to the other side, and when, of course, the more education you have, it's certainly helpful and empowering, which is the point because of the neglect and the misinformation. It made it worse, right? But the point is to be better and get better during this. It is a very difficult time.
Yeah.
So,
it's a not just like a year-long thing. This is like the span of this encompasses probably like a third or even maybe half of your life, would you say, correct?
It's half of your life pretty much because, if not longer, actually.
Yeah.
Because it starts 10 to 14 years really before the day of your last period, unless you're thrown into surgical menopause, then that's a different story on depending on when the surgical menopause was. And some people, of course, have menopause early, but the average age, which is normal menopause, according to medical standards, is between the age of 45 and 55. So if you rewind 10 to 14 years prior to that, that's your 30s. That's when we're having a lot of people are starting their families and getting into the careers, but we seem to peak more during menopause and right before menopause, and that's when we need to feel our best because we're if you have a career, and if not, then that's also the time typically when your children are growing up. So it's a very interesting time for everybody in the house. Everybody in the house.
Kids are going through hormones. Mom's going through her changes. It's like, it can be chaotic, and it's good to know that going into it when you're starting a family, and even when you're thinking about starting a family. This is good stuff to know, and that's really what I wanted to hit on as far as for guys. If you are looking to be a leader and serve your wives and serve your family, serve your sister, your mother, your aunties, everybody. This is not just like, oh, that's a female thing. Women, ladies, we'll let you worry about that. It's like, no, this is a huge life event. And if you want to be the best man possible you can be. I'd like to challenge you guys. Don't skip this podcast. There's going to be a lot of good practical knowledge. And if it's uncomfortable, just wrap your arms around it and give it a big hug, and we'll get through it together. Stacey's really good at explaining things in a way that makes sense to me. I'm not an expert, so I could always learn more. And so just to start things off, real simple, menopause 101 question. What is menopause?
Menopause is basically when your ovaries stop making your estradiol, progesterone, and may or may not slow down on your testosterone. And then you don't have periods anymore if you didn't have surgical, any surgery. So that's supposedly the day of your last period, which you never know when that day is going to come, right? And everybody's journey leading up to that, of course, is very different, which we'll get into.
And as a guy, I don't know what progesterone or I don't know what estradiol. No, I'm just kidding. But I don't know what that is. I don't know how that plays a role. Like, I kind of know hormones, but I mean, I'm a guy. I'm like, what can you break that down for me? I mean, even as far as like menstrual cycles and periods, like this is talking about reproduction, right?
So yeah, so when you start puberty and you start having periods, then you could get pregnant, right? So it's there to hold a baby, make a baby, whatever, and then eventually, your body says, okay, you don't need to be doing that anymore. You're all done. But we live 50 years, potentially 50 years after that. So that's kind of a long time. Plus, like I said, the time before. So for men, you have testosterone and estradiol. Okay. So we have estradiol, testosterone, and progesterone as big players in all of this. So for men, has a very slow decline over time. Might get accelerated a little bit at 40, but even more so at 60. But it resets kind of every day, whereas ours is a monthly cycle, right, when it starts. And then it can start getting wonky, not a nice little cycle anymore, 10 to 14 years prior to the day of your last period. Okay. So if a man can imagine pretty much with, let's say within a year's span, to shorten it for him, you wake up and you're not getting erections anymore. You don't feel like having sex anymore. You don't feel like going to the gym anymore. Like within a short period of time, instead of a long, slowly happening for a man. And you don't know what's happening. You're not remembering things. There's so many things, but it happens in a very short period of time.
So you're going 75, 80 miles an hour in the fast lane, and all of a sudden you see brake lights, and you're just like, skirt. Yeah. The screeching halt. Okay. So it happens. And you said it can start happening kind of slower. 10, 15 years, you start having maybe an irregular period. But the hormonal changes, is that still like a screeching halt? Like something's
and then
wrong,
it's done.
something's off.
And then it shuts off, like it's done. So, yeah. So we can start deep diving into that, but I want to do the basics first before we get into too much detail. So for a man to understand what that might be like, I mean, he's seeing it probably with the women in his life, but it's hard for us sometimes to imagine, obviously, especially a male, female like that, what that must feel like, right? It's like, it's hard to imagine what it's like to be a parent until you're a parent. Or it's hard to imagine what it's like to lose somebody really close to you until you actually go through it, right? You can try, but that's the best that I can explain to a man. And of course, in my household, before all of that, I talked about the body very heavily with my children since they were in elementary school. Parents said, yeah, go talk to Stacey. Because I don't know why it just feels natural to me to talk about the body, because it's just the body, and this is one of the parts, is the hormones and sex and stuff, and so it's not very difficult for me to talk about. So I've always been very candid with my children and my husband, and so they're very candid that way.
Yeah.
As well, and I have teenage boys. So, but it's served a very good purpose. They hate it when I talk about them and the detailed information that they do, but it's very clear
Yeah.
that they were raised with me. It's very clear when they have conversations with people and girlfriends.
Yeah, and I understand like the conservative approach. I was kind of raised in a conservative household, and where that stuff probably wasn't talked about at all.
Yeah.
And from that side of the coin, I always looked at it like there has to be some middle ground. Because either curiosity is going to kind of take over and you're going to figure out like the hard way, or just be ignorant. And a lot of guys are like, la, 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 don't tell me. But they're still going to get the information, and that's going to get lodged away somewhere in their brain. And then they can, reflect on that when the time is appropriate. But I never like being the person that has no idea, no clue, being blindsided by something, not being prepared for it. So at the end of the day, that's the biggest part of this, is just being prepared for whatever happens, and not so that you can be the fix-all. Guys, I'm going to tell you right now, you cannot save your wife or spouse from menopause. There's probably nothing you can do to help the situation either, except I'm here for you. Like, that's it. That's all you can do.
You just got to be there and be present and hold space. That's one of my favorite terms, hold space.
Hold space. What does that mean to you? What does holding space mean?
It's a safe zone. So, for example, if a man comes home, just like a woman comes home right from work, you've had a really bad day, you've had a lot of bad events, and you're hungry on top of it. Right?
Angry.
So when you come home, do you want to come home to somebody that's like, well, I don't care, tough it out, whatever. No, you want to come home to somebody that's holding space for you, that says, oh my gosh, tell me about your day. Let me get you a snack, until whatever's happening for dinner. Who knows, these days with our crazy schedules. But you want to have that safe space to just say what it is without judgment. And that's it.
And not to feel attacked, because whatever is getting projected or voiced, I mean, not all the time. Maybe sometimes you did something. Maybe sometimes you forgot to take out the trash or forgot to do something you say you did. And you feel attacked when that person is feeling that way. But as a result, it could just be how they're feeling about themselves, how their body is feeling, and learning to navigate that. Holding space for yourself is equally as important as holding space for others, I would say.
Yeah, and you're validating that person in their safe zone.
Okay. So menopause, the body's going through changes from being able to reproduce and give birth and bring life into this world to a screeching halt, to where you can't do that anymore.
Yeah. So it's like about 1,000 functions, and if not more. We still need more data. We talked about studies last time, and I guess I said something a little weird, like studies are just studies. Okay, what I meant was
Mm-hmm.
studies are useful, right? We take a certain group of people and try and extract information and have correlations and causations, right? And that data is very useful. But what I meant was they're just studies, meaning it's not in vivo either. Like I'm not having an individual interaction. That's what I meant by that.
And they should still be treated kind of case by case. Like you can still learn and apply what we know from those studies, but it's not just that black and white.
Because we are very individualized. So, yeah. So as a man, how else sounds good to describe what they should do and what that means for them? Because there is a high divorce rate at that time, and that's not the only reason, but I think it is one of the reasons.
Mm-hmm.
You know, they're even going as far to say that the suicide rate is higher during that time as well for females, 45 to 55 years old. That's pretty
so sad,
significant to say.
Yeah.
Right?
Mm-hmm.
So it's not, and we've always in the past in medicine disconnected the mental health from the physical health, but it's the same thing. It's one and the same.
Absolutely.
So the brain changes with menopause. Perimenopause, it changes. It starts changing 10 to 14 years before the day of your last period in your brain, which controls all of your functions as well.
So there's 1,000 body functions that are changing, or body and mind functions?
Body and mind.
Body and mind functions. Okay.
Mm-hmm. Yeah, because your mitochondria are changing the way that they're working because there's so many different cellular activities going on. We mentioned the insulin is affected by the change in your hormones, which means your cells cannot take in the glucose like it used to. Stop it. Go get your bowl.
There's your decrease in energy right there. Decrease in ATP.
Yeah. So if your mitochondria and your glucose is affected, that's it right there. Like just that alone, it's like, that's a game changer. Mm-hmm. For all your functions, right? Your immune function, your cardiovascular system, your neurological system / central nervous system, your musculoskeletal system. So everything's affected. Now, does everybody have every single symptom? No. You can't slice us up and see everything that's going on. But a lot of things that women are feeling because it wasn't recognized before this transition, it was just an autoimmune disorder or just depression or just anxiety or just insomnia.
Or bipolar.
Yeah. Or just you're getting older. You just need to eat less calories, work out more. It's just a frozen shoulder. It's just those things. But what we're finding out, it's because of the hormone changes that those things are more likely to happen. So it wasn't correlated to menopause in the past. Mm-hmm. So yeah, I think it's a pretty big deal. Before mainstream medicine really started getting involved politically a few years ago, like I said, we practiced it in integrative and functional medicine with smaller studies and less studies. Now there's more and more, which is great. Mm-hmm. Because if mainstream gets involved, that means there's bigger financial people involved.
Yeah.
So that's great. That's good. We've all in integrative and functional medicine, we've been on the bandwagon. Like, we need some hormones, people, men and women. We need to figure this out. We need to figure this out. So it's nice that mainstream is catching on and being very vocal about it. Really, really important.
Mm-hmm.
And because of this too, they're also finding more out about the types of exercise and food, and post baby, postpartum, and even just your cycles and how you should live with your cycles. So this movement is really good in general for all times of your life. So no one can escape it unless there's death. So it's not, 51% of this population on this planet will experience this. This is not just a small population of people. 51% of the people on this will experience this.
Yeah. And would you say that if you do the hard work early, if you prepare for that in your teens, your 20s, your 30s, it will be easier? It won't necessarily make it non-existent, like as far as symptoms and how the whole, that season of life goes, but you do have control over how you prepare for it. And can that alleviate some symptoms, and how, can you go through it easier if you have better habits in your 20s and 30s?
Sure. Yeah. It won't be 100% for everybody like that, right? But I do think that if young ladies are taught about the right kind of exercise and nutrition and healthy mindset, along with the people around them, about how their health needs to be a priority, everybody's health, but just because it's more detailed and intricate for females and needs to be done different than it had been, I do think that going into perimenopause is much, much better. Mm-hmm. Much, much better. And we know some people say, oh, I never experienced menopause. Well, they weren't necessarily aware of all that meant either. Mm-hmm.
Yeah.
So, I think having good support like this and being there for each other is also important, because, as a PA doing this for 11 years, the hormone part, the main thing that women say is, oh my God, thank you so much. I just felt like I was going crazy. I just didn't know what else to do. And it just means so much to me that you actually listened, that validation, and told me I'm not crazy. Well, you're crazy because you're But no, it's just they feel like you feel out of control. You just feel totally out of control. I'm not saying everybody, but whatever it is, whether it's your weight that you're focused on, or your sleep, or you can't perform the same at work, or you're forgetting things that you didn't forget before, just managing your household, or you can't gain muscle, you can't get control of your emotions, you don't feel like having sex anymore, or it hurts when you have sex. Think about that, how you would feel as a man that all of a sudden it's like having a severe brain injury for a man, because you just, like I said, you can't do those things. So now what? Now what? So think about if you get ahead of that, like you said, it's not going to be like you're not going to experience it.
Yeah.
But it should be much, much better. It should be much, much better.
I think it'll help people kind of take their feelings, well, as far as for guys, take their feelings and emotions, because regardless of what people say, we're all emotional creatures. So, like, even if, yeah, I don't need to harp on that too much. But yeah, we all have emotions, and the last thing anyone wants to feel is that this is caused by them, or this is being pointed towards them. Just having that knowledge that, hey, inevitably your wife is, or your spouse is going to go through these changes, and it's not because of you. There's nothing you did wrong, but you do have a responsibility to be there for them, support them, provide that space, and not take anything personal.
Yeah. Yeah. I mean, even my sons, my husband sat them down and said, there's going to be some changes around the house. And there's going to be, everybody's got to do more. Mm-hmm. Not that they didn't before, but, so we need to make these adjustments so your mother can have more time for herself and her health and her rest and all that needs to happen. And it's not you, because I think my youngest one kind of did take it. Like he felt almost like a burden because I was more tired. And felt overwhelmed, and like I couldn't keep up with, driving him to his stuff. And I had to accept that also, that I had to do less in order to be more.
Yeah.
Mm-hmm. For that time being. And if I can't imagine if you don't have these conversations, that's how children are. That's what happens when you're a child. You think it's all your fault. You're the problem.
Yeah. I totally resonate with that, because as kids growing up, we had no idea what my dear mother was going through. None whatsoever. It's not until just recently having conversations and, oh, do you remember when I just left the house and jumped in the car and drove and left you guys there and needed to get away because there wasn't that space in the house for my mother to feel like safe. So she had to leave physically because she thought she was crazy. So it's like, and that's so cool of your husband to be able to talk to the boys and be like, hey, like going to bat for you, being your advocate, being your friend, being your best friend, being your partner and your spouse, and being like, and say, hey, we need to step up. You guys are growing into young men. This is what this is going to look like. This is how you're going to support your mom. I think that's really cool that your husband was able to do that. And I think that's kind of how it could look for a lot of families in the future.
It really could. It really, really could. Yeah, I can tell sometimes people are uncomfortable. Even, let's say I'm at a gig and there's plenty of mothers there and we're all about the same age. And I'll just say something like short and quick, like, well, what that menopause time, how it is when you forgot blah, blah, blah. I'll just, little things, because it's normal for me to think that. And then they look at me and it's almost like they're scared to say anything, but then they're relieved at the same time. Like, I know. Yeah.
Yeah, for something that happens so often, we should be, it's kind of mind-blowing, but it's kind of also not, because sometimes we have the tendency to kind of just avoid or, move around uncomfortable situations. But the more we talk about it, the more we're prepared, the more we're informed, and it should just be normalized. There shouldn't be deaths over this. There shouldn't be divorces over this. There should be camaraderie and a togetherness and support that comes out of it. It should be a beautiful transition. There's all this beautiful life that was created, hopefully, in your early years, and now we can help and advocate and support that transition because that's just a part of life.
Yeah. Yeah. Um, my husband even does that. There's a lot of, we're all in the United States, but there's a lot of cultural differences here.
Mm.
And my husband is so cute. So he's not white, by the way. So he's Mexican. So in his
Woo!
culture,
Viva Mexico!
yeah, it's definitely a hump that he had to get, that he wanted to get through and be very anyways, he's done amazing. He talks to the other dads all the time.
That's awesome.
And that's all different cultures, because we know that we're this beautiful melting pot here, and that is going to come into play. We know that as a medical provider, we have to be able to read your patient. And every time that we've talked about it in public, it goes very well, and it is amazing. There's never a person that's mad or offended. Everybody is relieved.
Yes. It's so funny. We're so funny as people. It's just like, it makes us uncomfortable. But as soon as we talk about it, it's like relief. We're not alone. We're not crazy. Everyone is going through this. That dynamic that, like, the dynamic can only be made worse, and the wedge between the family can only be driven further by not talking about it, by giving into the insecurity of the uncomfortableness of the subject. If you let it be uncomfortable, you're making it uncomfortable by not talking about it.
Yeah. Yeah. So it's been an awesome journey. I'm so blessed. I mean, my husband's
Amen.
just been amazing through this. And even though I provide this care to patients, and it's such a passion for me, and it seems to come so natural for me to do for whatever reason. I don't know. I feel like this field just kind of chose me. I've been a PA for so long. But it, how we were saying that transition, it's still hard on the individual. You're still going to have your individual experiences. I still have hard days.
Yeah.
And it's been about 1.5 years, 2 years since my last period. Like there's still hard days. And we use our hormones more and less. It's not like you get on a regimen and whoop, this is it for the rest of your life. Because we weren't that way to begin with. We use more, we use less. We metabolize more, we metabolize less. So you're gonna have great days, great hours, and not good ones mixed in with our trauma, like you said, with your was it your friend, or she's a therapist or whatever?
Yeah. So, with therapy, when you're doing, I mean, because it's like a lifelong practice, because those emotions don't go away. Kind of like learning how to manage and deal with life events and traumas. That's a forever thing. You just get really good at it. You get good at recognizing when those triggers come up, but sometimes when there have been life events, and then I was talking about this with Tanya Ferguson. So when you have those life events and then you are going through menopause, it's kind of like you don't know if what you're feeling is from those life events or it's just part of that natural process. So it's kind of hard to distinguish where it's coming from. But knowing that, this could just be part of menopause, that's relief as well. It's like, I thought I was doing so good about those traumas. You are. Okay, good. I'm doing good. Okay, great. This is natural. Okay, that's a relief. So, yeah, it's really important, I think, yeah, just to talk about it, because a lot of people just don't know. They were never informed. They are just figuring it out now. Or they had a hysterectomy and they were thrown into it and they didn't know what would come up after that. So what's the different? Are there different types of hysterectomies? You can have like a complete hysterectomy. You can have partial. What's all that?
Yeah. So if they just take your uterus and leave your ovaries, you are still producing hormones. Let's say you get it at 35, right?
Sorry, just to pause. A hysterectomy is like the non-natural way that you're not gonna have kids again, right?
Yeah, they're gonna either take just your uterus or your uterus and your ovaries.
Okay.
Or maybe they'll leave one ovary. So there's like a few different scenarios that can happen, right? So let's say you're 35 years old and you need your uterus taken out, but they say we're going to leave your ovaries. So you'll be fine. Meaning you'll still have your hormones, but obviously you can't have a period because your uterus is gone. So you're not going to have a cyclic bleeding, but you are still going to have cyclic hormones as if you were going to have a period. However, there's two parts to that. Even though they leave the ovaries, because there is, the surgical removal that it was attached to, right? The uterus, the hormones typically start changing, and they'll start changing much sooner than you probably would have gone through menopause. So let's say maybe you were destined to go through it at 50, but you're probably going to go through it at 45. So that means once that happens, your hormones are going to start changing. And almost always when I have females, they'll find me like 10 years later, of course. I knew I felt different. I knew it. And they kept saying, no, you can't feel different because you still have your ovaries. But they felt different because the hormones were changing, even though they left the ovaries. And then now let's say we take all of it. We take all your ovaries. Well, obviously, then you have no hormones being made by the ovaries. Now, our adrenals do make some testosterone, so you may or may not have a little bit of that, but it wasn't as much as we know you were making before. We also, females, testosterone is a very important player, just like for men, okay? And estrogen is also a very important player for men as well. So yeah, I mean, you're basically, just cutting that off in one day.
Mm-hmm. And why have a hysterectomy? Why is that even an option?
So typically, if women started out since puberty with a lot of hormonal issues, if they had PCOS or fibroids, typically come later, like after 30s.
What's a fibroid?
It's a tumor. It's a benign tumor, non-cancerous tumor, and it causes bleeding. It can bleed. Okay. And then there's endometriosis, which is a whole issue with the lining of the uterus, and it can grow outside the uterus, and it's very, very painful. So women have hysterectomies typically, or maybe they don't even know why they're having period issues, and they just remove it because they can't control it medically.
How common is it to have? I mean, I know we discussed PCOS and how it's becoming more common. That's centered around, nutrition and, I mean, not just nutrition, but like a lot of things. But how common are hysterectomies because of these, benign tumors or endometriosis?
I don't know the actual statistics, but I know that I think it's weird because I get two different feedbacks from patients. I get the one of, they let me suffer for so long until they finally took it out, like bleeding and pain, right? And so they're so happy to have it removed, to have that part of their life removed, the pain or the bleeding, right? But But then I hear, well, I don't know. They didn't really say there was any other options that this was done. So I don't really know the statistics. I haven't looked it up, but I think it's probably relatively high. If you have any issues, that seems to be the last resort, but it happens pretty quickly,
Mhm.
you
Yeah,
know?
I'd be curious to look at the data because I always like looking at root cause and why that's an option, and if there's anything we can do to prevent, or to decrease that number. Whether it's yeah, I'd just be really curious to look more into that.
I mean,
So
I definitely think that turning off epigenetically, like we had discussed before with chemicals, nutrition, a better lifestyle, and exercise, that it would decrease a lot of these issues. Um, and even just a little bit of bioidentical progesterone can go a long way. Uh, that it would probably decrease a lot of hysterectomies.
Mhm.
I think. I
so
think.
endocrine disruptors, like chemicals, like toxic chemicals. I mean, even just in our water. That's why I don't like stay away from tap water. That's me with my tinfoil hat on. And then just spending more time outside, grounding, less sedentary, bet whole foods. All that plays a
Yeah.
huge role.
And
And then sorry, go ahead.
and that might change to the average age of menopause is supposed to be 51, but I've been getting a lot of women in their 40s like myself. I went through it at 45. I was not expecting that at all because I'm pretty healthy.
Mhm.
And anyways, but I think it's probably shifted the symptoms, increasing them maybe also because of all of those things, the
Mhm.
environment and our lifestyles.
Does infertility have a role to play in how early you go into menopause as well? Like if we're seeing it in the early 40s, in these ladies, is there a fertility issue as well?
Well, you mean fertility issues from the environment or just going into menopause? That having children will change, and depending on how many, uh, when you go through menopause as well. And then they say it's also partially genetic. Um, but I think that also extreme stress and trauma can really change when you're going to go into menopause. So
Mm.
the fertility issues are, you know, that's an interesting question in itself because it also depends on the male.
Mhm.
So because they're finding really a lot of the miscarriages are from the male sperm,
Mhm.
which was never ever ever known before.
Yeah. It was always like, oh, there's something wrong with the ladies. But it's like, no, guys, you got to really take care of yourself. Like, you do play a role in this.
Yeah, they actually, I guess it's a pretty big role. That's something new that I've learned recently. So that's cool and nice information.
Yeah.
Women that go through these things, they blame themselves, even though they they didn't do something to themselves, right? But they blame themselves. It's just part of our nurturing
Mhm.
piece of us, I guess.
Yeah, I read an interesting study about like guys who just drink IPAs. I think IPAs was like the specific type, or just beer and stuff. Like the quality, sperm count was significantly less just because of what's in these alcoholic beverages.
Yeah, well, I know alcohol's a toxin.
It's a metabolic disaster. It's poison. It's ethanol. It's like, I mean, I get it. There's some good wines out there, like cool, like if you enjoy it, be a responsible adult. But at the end of the day, it's like we can't, as guys, we can't neglect the fact that we do have a major role in conception, infertility, and we need to do our part as well. It can't, like, yeah, it's crazy that it was kind of just more put on the ladies that, like, oh, you can't conceive. You can't. It's a you problem. It's like, no, takes two to tango. So, guys, work out, eat good, watch your light environment, get outside, be active, get a regular panel done. Like, most guys don't even get their blood done in their 20s or 30s. I think it's just becoming something where it's like, I kind of want to check where I'm at. Have a good baseline. Get it done once a year. It's really easy. It takes seconds to get your blood drawn. And at least and you can be accountable to yourself. And it's just really like a report card.
Yeah.
You want to know how you're doing in school. You want to know how your body's functioning. Just get it checked.
Yep. Yeah.
What labs would you want guys to get checked? Like, guy turns 30, hasn't been to the doctor in 5 years or a few years. What should a guy get checked for?
Yeah, so you're going to do like a cardiac panel, depending on what your insurance is paying for. It can, paying for your own labs can add up, other than the basic stuff, pretty fast. You could spend $1,000 pretty easily. So, typical cardiac panel, looking at your cholesterol. You can even, a lot of insurances are covering the genetic pieces of that as well. And they should cover vitamin D. They should cover like a CBC, looking at your hemoglobin hematocrit, because testosterone makes red blood cells. And so that's going to be a whole, thing to look at, whether you need testosterone or not. I love getting testosterone levels then and estradiol, especially if they start noticing a change or they have some severe injuries, then at least you have that. I mean, in your 20s would be more optimal, right? But
supposedly.
Yeah.
I see some 20-year-olds have the T levels of 235 nanograms over deciliter. It's like, what?
Yeah. And then don't really need a prostate test yet. And of course, your thyroid test is really important. TSH, free T3, free T4, because TSH is good, but it could be normal. And you might need to look at those other things, and getting an antibody marker too for the thyroid is always good. To make sure that, there's not the start of some autoimmune issue. Could be from your environment or whatever. But, I mean, those are just basics, and they're almost always covered by insurance.
Yeah.
And if they're not, I think it's under $100 to run those basics.
Yeah.
And then, sky's the limit. You could keep ordering things, but just to at least have an idea the A1C, how close you're getting your insulin. Is it going up? Even though you don't have diabetes, where's your insulin at? Because if your insulin's not good and it's too high and not at an optimal level, then you're already on your way. You're already on your way to becoming a pre-diabetic. And that's, like we said, glucose is everything. So you can't use glucose appropriately, then that's that. So, yeah, I think that I would take care of them pretty.
So complete blood count, CBC, cardiac panel. You don't need a PSA, but I mean, if you're in your 40s, get your prostate checked. TSH for your thyroid, but specifically check T3, T4, and then check testosterone free and total. Check estradiol, and because you don't want to be estrogen dominant as a man.
So the levels are actually, they say they should be a little bit higher than they originally thought men's estradiol should be, because you use this as a function as well, right? So you want to make sure it's not too low or too high. It's rare that I see a man's testosterone or estradiol too high, even when they're on testosterone replacement. I mean, the last the last conference I went to, they're saying even if it's out of this range that they came up with, which needs to be changed, if they don't have symptoms of elevated estradiol, then there some practitioners aren't even giving them estrogen blockers. They're just letting it do what it needs to do for them. And of course, looking at lifestyle changes.
Yes.
How much estradiol that a man is making from the testosterone. So, yeah.
Cool. So that's a little, I don't know, a little sidebar on the men's health. Getting back to the hysterectomies, so we have partial, just taking the uterus and then leaving ovaries, or just a complete hysterectomy, taking everything, or maybe leaving one ovary. And then we went over causation for the hysterectomy. So post hysterectomy, you're at that screeching halt and not really even in the driver's seat. Like, you're like the passenger as the lady. It's like you're going 80 on the freeway and this is just inevitable. We're coming to a screeching halt. And what is this? How does this feel? I mean, we know you feel, you mentioned feeling crazy or just different. Kind of just break that down for us. Like, what are the ladies going through?
So first they'll say things like, I felt really tired. I couldn't focus. I was waking up frequently at night, may or may not have night sweats or hot flashes. And I just couldn't focus. Fatigue is just a big, big, big one. So then I can't do all the things that I want to do that I enjoy, or I can't exercise. And then I'm gaining weight. I don't feel like having sex. If they're with, with a partner, their husband, or it hurts so bad when I have sex. So they told me just to use more lube. Or, well, if I really want to do hormones, they'll say, like, I'm feeling horrible. So I go in and I tell my practitioner, and the practitioner would say, okay, well, you could do them for a few years then. And they just, throw them on something and then come back, whatever, in a few months. So there's no individualized care on that. Just put them on whatever it is that the practitioner had learned, because we were all taught nothing, pretty much, very, very minimal. And so,
all that money, all that time, learned very little.
Yeah. Yeah. And so, and that's including OBGYNs too. It's all over social media now. They've all said. So, they just feel like, I guess I'll just have sex for my husband, not for themselves anymore. So now they have no quality of life. They're not sleeping and they're tired.
I would be depressed.
Yeah.
That's tough. And then throw in the factor that they might not just have space to even feel like that's acceptable in their household because of all the life demands that are going on. There's no understanding. We can't talk about it, and it's uncomfortable. And how do you live?
Yeah. I don't, if people all have different coping mechanisms. I feel like in San Diego anyway, that wine became a huge coping mechanism for a lot of females. That it was more acceptable because it's healthy, right? It's wine.
It's better than getting angry and lashing out. And
yeah, or they just kind of suffer in silence. Yeah, I think a lot of women really suffer in silence.
unless you're Hispanic.
Yeah.
I've heard stories about, because my mom's side of the family is Hispanic and Filipino, so I've just, heard stories, and yeah, not too much silence there.
Yeah, they're, more more yelling. Um, I've had less yelling. That's interesting.
That's good.
But compared to when I was younger.
Yeah.
But the anxiety and depression is a big one. It's just so many systems affected. I don't think that they actually equated it until they finally come to somebody like me and they're like, oh my gosh, that makes so much sense. They just kept trying different things, trying something else, trying more exercise, trying something for sleep, or, they're fighting going on a SSRI, Lexapro or Prozac or whatever, right?
Terrible for you.
The doctor's like,
Yeah.
well, yeah, you're anxious, you're depressed. Here, let's try this, Um, so it's it's really sad when you think about it that there's no
Yeah.
conversation prior to the hysterectomy. Like these things will most likely happen. Will most likely happen that you might go through. So we're going to make a follow-up. Oh. And we're going to talk about it there. Kind of like when they came up with the postpartum regimen. We're going to talk about how you're feeling postpartum. So, I think that as more practitioners are learning now, like I said a few years ago when things started changing, there is going to be that conversation. The same with breast cancer patients that get ripped off of their hormones. There's got to be a conversation of quality of life, and of course there's different kinds of breast cancers and what it is that are the risks. What are the risks and benefits for you, especially if you're young and going through breast cancer, because a lot of the treatment is going to also put you into like a menopausal state. So that's another group of women that definitely have been discarded because, nope, can't even talk about it, blah, blah, but actually we can talk about it. There is treatment for women like that as well.
And we
So I know
should
that
talk about it.
that was a side note.
Yeah.
But that is also a form of menopause that is severely neglected.
Breast cancer?
Yeah.
Cool, let's talk about it. So obviously if it's kind of in the family history, there's a risk. Have they looked at other potential causes of breast cancer if it's not within the family, like other things that could have? Alcohol.
It's a big one. So it's like 1 in 8 women have breast cancer, but not 1 in 8 women have the genetics. Yeah. So we know cancer is caused by stress, by toxins, right? And even the old BRCA testing, you need to get new BRCA testing if you had the genetic testing for breast cancer was negative 15 years ago. You need to do it again, and it should be covered. Because then you could make choices as well if you want to have a mastectomy or not. They talk about hysterectomies when you have breast cancer. There's definitely a broader discussion now, but it's not across the whole United States yet. It's a work in progress, just like menopause is. I think Dr. Amen, the psychiatrist, is the one who does all the brain scans, and Dr. Lisa Mosconi is the one that showed the receptors on the brain, the estrogen receptors on the brain. And we know that there's progesterone receptors too, but he can physically show. So like I said, not just the chemical change, but the physical change in the brain that starts 10 to 14 years before menopause. So and then they were able to look at how they were able to prove this in science was looking at these young women that had the hysterectomies. Showed the same brain as a person that went through it at 51.
Wow.
So I'm like, okay, that's it. Do you need any more proof?
Yeah. It's real.
That's it. It's right there. It's right there. Both physically they could see it and chemically.
Mm-hmm.
So that's really good data. That's really, really good data, right? Mm. Those are really good studies. I really like that. I don't know what the other countries where they're at. I think some maybe more progressive than us and others not, you know? And I really, really, really like the work that's been done. And this was not present when I started doing hormone replacement. What is how the actual progesterone starts dropping 10 to 14 years before whenever your last period's going to be, right? I mean, that's a long time. That's a long time. And so it also kind of just my own correlation. It's like, okay, well, if you're having babies at 30, in your 30s, you're starting perimenopause already. So what does that look like for postpartum? Because after you're full of progesterone, you have the baby, you know, it goes back down and sometimes doesn't come back up because you're probably already in perimenopause.
Ew,
So your postpartum might be worse because of that. I don't know. I haven't, because I don't deal with a lot of postpartum, but I mean, that certainly needs to be studied a lot more too, because maybe they just need a little progesterone to also help them, along with, of course, the other stuff. But yeah, and then like I said, the estrogen. So we've got our estradiol, progesterone, and then testosterone's in there, right? Cycling. And when the progesterone starts flattening, you could see like, okay, so now you have a little bit more of this estradiol and not enough of the other cushion to balance that out, right? How that might feel. And then what starts happening after that, instead of this nice hump of the estrogen, it starts getting really erratic.
The progesterone?
Instead of a nice cycle coming in all over the place. So now you can imagine, like, how in the heck is that going to affect all of your cellular activity? It's going to be nuts. It's going to be nuts. And we have testosterone as well, a lot. We just don't have as much as you, but within our hormonal system, we also have a lot of testosterone that can also start fluctuating and dropping. So we've got 3 hormones that are now affecting every single system in the body. That's a lot to manage. And it's not going to be a quick office visit like, here, try this, okay, I'll see you in a few months. Ooh, that's not going to be good either.
Yeah.
I mean, that's a very tricky thing that I can't slice you up. Getting labs every day, all day is not practical. You know, that's not going to work. I mean, they're even talking about basically a lot of menopause specialists. They're like, no, we're not going to, don't even get labs. Let's just focus on what's happening and start a regimen and start getting you dialed in. Mm-hmm. Because your estrogen can go from 20 to 400 at this time. Mm-hmm. So it's very complex. And to think that it can be taken care of by simple, no, it's the journey.
Mm-hmm. Buckle
it's a
up.
Journey.
Buckle up. It's a journey. Put your seatbelt on.
Buckle up. And you're going to have to be a part of it. You're going to have to be mindful of those things. And that's the beauty of, you know, I know there's controversy about certain things in the compounding world versus commercial hormones and products. But one of the beauties of a compounded estradiol cream is you can change it the next day if you need to. 2 clicks, 1 click, 3 clicks. That quick. Very quick. You know, patches are cool if you're pretty stable. Maybe you're you're already over the hairy time and everything's gone. But again, like I said, even if you're over that hairy, wonky time of the estrogen before it flatlines and leaves, you're still going to be using your hormones differently. I even talked to the pharmacist the other day. Okay, gotta tweak my estrogen. And he goes, you went through a lot of stress recently, didn't you? Yep, I'm having night sweats again. Stress metabolizes the estradiol much, much quicker. So does exercise. If you change your exercise regimen, it's not, this doesn't work for me anymore. That's not the causation, is not that it doesn't work for you anymore. It's what has changed so we can make the change for your life now. So that's why it's a journey. It's not so simple.
I know we touched on it briefly last time, but what is the ideal workout protocol for we're here, and like how do I help manage these, how I'm feeling? I don't feel like working out. I'm fatigued, I'm brain foggy, I don't feel like doing anything. What should I do?
I always tell people, until we can at least get you feeling a little bit better, 10 minutes a day, I want you to either stretch or go for a walk. Just 10 minutes. Give yourself 10 minutes.
Mm-hmm.
We're not going to worry and stress and judge, because the woman's going to judge yourself. I didn't do this, and I didn't do that, and I didn't do this. We're going to take away all of that. So first, we're going to work on the stress, the validation, and just getting some hormones in there and trying to find a balance. So that's what I say first. And, 10 minutes is pretty reasonable.
I would also throw in there, if you can get outside and do it, do some grounding, do some breath work, prayer, meditate. 10 minutes is not hard to do. I mean, it's probably really hard. But if you can tell yourself it's only 10 minutes, then there's that grace there that you don't need to go get ready, go to a gym, do 45 minutes of intense, some cardio, some weights. Like that's just a lot. 10 minutes, get outside, get some fresh air. Even if it's not sunny out, just get it. Like, it wasn't sunny out today, I was still outside doing my little, dynamic, calisthenics workout, and it feels so good. So 10 minutes is great. So that would be like phase 1. Okay. We've been consistently doing that. We're making a little headway now with what would be like a phase 2 protocol. Now you're like, okay, I got some momentum. What's next?
Yeah. So, bring them back for their follow-up within a few weeks. And they're like, I am. But the hopes is by then, most of them, I'm finally sleeping a little bit better. So then now I am feeling a little bit better. Okay, in my moods, I'm not as anxious and sad. So this is good. But, we still have work to do. This is pretty typical, whether it's libido or vagina, or the hot flashes usually go first if they're having that symptom. And the sleep is one of the things I work on next. And then the rest starts to come. So then we say, okay, so now let's do some tweaking. And now I want you to incorporate muscle resistance 2 days a week for 15 minutes. And then I go from there. Yeah. And then I ask them about how much protein they're getting in and fiber. And then I tell them, we're not going to talk about all the bad things you've been eating. We're going to just talk about what the good things that you're eating. I really just try and focus on the good and let the negative slowly go down as we keep pumping in the good. So how much nutrients are you getting? How much protein are you getting? Okay, 60 grams a day, but for your height, you need 120. Okay, cool. You're halfway there. start adding some more. Start adding some more fiber. Okay? You can't do fiber overnight. If you're getting 10 grams a day and you go to 35, you're going to be miserable. So you can't do that either anyways. So, and just, I tell them, look, like, some days you're going to get all your protein, and other days you're like, oh, I can't eat any more protein. Okay. But start playing with it. Start finding easy ways that's going to work for you. I can't tell you what's going to work for your lifestyle. Mm-hmm. Whatever that is, if it's nuts that you keep in the car, certain walnuts and almonds and whatever, pistachios, or protein shakes, I'm really conflicted on. This is where I defer to you on the protein shakes. As a nutritional specialist, I'm really torn with that right now. And that's it. I really just focus on those things, and lo and behold, little by little, it just happens, right? Like, some people do like to be more drastic. Okay, I did this, but I feel like that kind of can lead to burnout. And once something happens, because life keeps going and something's going to happen in life, whatever it is. It could be something as simple as an injury to somebody passed away, to a loss of a job. There's always going to be something that's traumatic going on. So if that happens, it's really easy to modify because you have already done that kind of work. You already know what that modification is. You know what? I can't do that anymore, so I'm going to go back to just doing this for a while until I'm out of this hairy part. Mm-hmm. And then you can wrap it, because that little bit's much better than nothing.
Yeah. Yeah, being gracious with yourself. If you miss a day, at least you did your 10 minutes of stretching. You did your breath work. You did that. That's like your baseline. Just always getting that in. If you stuck to your diet, cool. If you didn't, it's okay. You're going to get back on it tomorrow. It's okay. It's not the end of the world. Don't say that, but if your guys
vacation, right? I'm like, vacation is one of the best things you can do for yourself. Yeah. And my advice too for when I talk to females is I say, look, this is how I do it. If you want to know how I do it, this is how I do it. Because I'm not perfect, right? I got my life too. So every morning I prep my bag to go, whether I'm in the clinic or I'm rounding, not on the weekends, but during the work week, okay? I prep it with my proteins, my yogurt, with my nuts and berries, whatever. That's because I like that. I enjoy that. Or cottage cheese. I may or may not take a protein shake in my coffee or not. And then I have a vegetable in there, or a can of tuna or something, another protein with some fiber. And then, I feel like if I have with me at least half of my daily protein in my bag, I got it. It's done. It's right there. Okay. And then whatever happens the second half of the day is whatever happens the second half of the day. If I get a chance, then I get to have my little meal at home and la 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 la, that's great. And if I can't do it, then I can't do it. If something else comes up and I got to be out at games and this and that, I'll make the best choices I can when I'm out. And that's that. So I just prep half of my day. That's how I do it. But maybe something else works for you. Mm-hmm. But that's just how I've done it for so long that now I don't know how to leave the house without it.
Yeah.
Even on the weekends, I always grab like a bag of nuts and maybe some alkaline water or whatever. Mm-hmm. Even if I just have, God forbid, I know, uncrustable from the freezer.
It's something.
At least there's 8 grams of protein in that, okay? It's not just a bagel. I know. But it's like, that's like my backup, mm-hmm. right? Because I gotta have my backups too for hairy times.
Mm-hmm.
But anyway, so that's how I approach a lot of the females. And getting in 2 days a week, 15 minutes of weight resistance is extremely useful. Like, it's really underestimated. So I know there's other providers out there, but Dr. Ben Bokikio, I think I mentioned him before, invented the smart workout and strength training for 15 minutes. It really works. But you have to lift heavy enough. I mean, you have to lift heavy enough, right?
Yeah.
So there's many ways you could do weight resistance, but it really makes a big difference. And so the reason why we'll go back to, I'm seeing a patient and I slowly work them way up to at least that, right? Bare minimum. This is what you're going to do. Whether you're overweight or not, I don't care. It doesn't matter. This is what is the bare minimum now. And let's say we're not just regular perimenopause. If you're 35 and older, this is the bare minimum. You got to get your protein and you've got to do it these 2 days, 15 minutes, weight resistance, right? And get outside, get some walks, get some fresh air, do all these things, right? Okay. So, I have the discussion with them about, hormones and safety, right? What does that mean? What does it mean when they say, are these safe? That's a weird question now to me, because I've prescribed a lot of different medications throughout my career as a PA, and nobody asked, is this cholesterol medicine safe? Well, let me tell you what that cholesterol medication can come with, or blood pressure medication, or antibiotics, what they do to your gut. There's a lot of medications, but for some reason, nobody asks that question. They only ask it with hormones. Well, we know the reason why they asked for hormones, because they were terrified. They terrified women and medical providers in 2002, which were wrong. So, um, so we talk about the correlation and things of hormones. Like, so what are you doing that's not safe right now? Outside of taking hormones, what are you doing that's not safe for your body?
It's a good question.
Because it's really hard to say. I mean, they've proven transdermal on the skin, estradiol does not cause blood clots. Does not cause blood clots. So what is it in your life that would cause a blood clot? Is it genetics? Is it you're in the car all the time, you're flying, you're smoking, you're sedentary, you're having multiple surgeries? What is it that can cause blood clots in your life? Because this estradiol cream is not going to be causing blood clots. So we'll talk about that safety. We'll talk about, the causes of all the different kinds of cancer. The one thing that I need females and males, because when they're with them a lot of times, they'll be like, my husband says he doesn't want me to take them. So the studies have shown women, let's say you were on hormone replacement, and then of course we know as age increases, you're more likely to have all kinds of cancers, especially breast cancer. For men, that's prostate cancer. Right? I think it's even like 1 in 6 men for prostate or something. I think it's even more than breast cancer. So that's just with age, right? Without your hormones, without the hormones. Okay. So we're saying you're not on hormone replacement. We saw this happen. We saw the increase in cancer, breast cancer, right? We saw the increase in heart attacks and stroke. We saw significant increase in fractures, especially without the appropriate nutrition and exercise, not just the hormones. And we saw a significant increase in dementia without hormones. Okay. So now you're going to be healthy, get as healthy as you can. Can't control everything, right? And utilize this hormone to also continue the benefits of those things that you're doing, so that you can use your protein better. You can use your fiber better. You can gain muscle because your muscles and bones are significantly affected without hormones. It's called, if you can't gain muscle and you're working out really hard, it's called sarcopenia. Sarcopenia puts you at risk for osteoporosis. So every single system is affected and connected, right?
Yep.
Or maybe you have severe joint pain or an autoimmune disorder now because the hormones weren't balanced and replaced for you to be able to do these things. So if we're looking at risk and benefit, in my opinion, the benefit is significantly more than any risk. So if you were to be diagnosed with breast cancer and you've been on hormone replacement and now you're 58 and they're like, okay, you have breast cancer. You have to come off all your hormones. They have to give you your diagnosis of what does that mean? What kind do you have? Because there's different kinds. What your treatment plan is. What do you want to do surgically if that's part of the treatment plan? They know that the survival rate of a woman that has been on hormone replacement is almost 40% better than the person who wasn't. Because think about all those symptoms that I just talked about that we've improved, right? The function of, and now you have to fight cancer, whatever treatment plans that you're going to be doing or not doing, right? So if your body's so healthy until that diagnosis, not because the hormones caused it, even if it's hormone positive, estrogen or progesterone receptor positive, your chance of survival is that much better. This is pretty good data also.
Yeah, this is really, encouraging.
Yeah, I mean, I'm like, that's so cool. And some of that data is from the old school hormones, the synthetic hormones. It's not even the bioidentical hormone data, That's going to be even better because even less risk factors. The old school synthetic is what causes the blood clots and may or may not be breast cancer. However, that old school synthetic estrogen helped the bones a lot.
Interesting.
And it's 1 in 2 women after menopause will have a fracture. I still find that so crazy that that's a statistic. Like, that's crazy unless you're doing all these things that we're talking about. But think about what a fracture does to your life.
Oh. Yeah. At that
we're
age.
Not talking a 12-year-old kid, get the cast off and boom, you're back out again. No. We're talking about probably a lower extremity fracture. And what that's going to do without exercise to your mental health, to your weight. Now you're going to self-soothe with food. I mean, this is a very, very big deal.
Yes.
This is a game changer, understanding that 1 in 2 women have fractures after menopause. That's nuts.
Yep.
That's nuts. So, and then, the other thing I forgot to talk about, I know I mentioned the dementia. They said 2/3 in the nursing homes, which, by the way, I also round in the nursing homes, are female with dementia. 2/3 are female. So what was the correlation? Well, Dr. Lisa Mosconi showed most likely it's that lack of hormones from menopause that increases our dementia versus the men, right? Okay. The other thing that I forgot to talk about was the urogenital system. Okay, so we think it's just about the vagina, right? Okay, does the vagina still work? Does it hurt when you have sex? Is it dry? Can you have an orgasm? Many people, either it takes too long, they give up, they can't have an orgasm, or it's painful and they give up. Nothing's working. Okay. So that's just the sexual part. And then there's the urinary part because the urethra is in there. So that is significantly affected, meaning all the pH changes, all the cells change in there. So now you're at risk of getting chronic UTIs, which eventually how long does it take before you become resistant to an antibiotic? And then it goes to your kidneys, and then it goes to your blood. So now you're dealing with chronic UTIs. Now you're dealing with kidneys that are declining, and then it goes to your blood and can kill you. Mm. It's really game changing when you're putting. So if the systemic isn't enough, which they're saying basically we should just introduce vaginal estrogen in our 30s. Well, duh. That makes sense if perimenopause starts in your 30s, right? Hello, that means all of those tissues are changing in the urethra and the vagina. So if we start using it twice a week, a little pea-sized amount inside, it helps keep that cellular activity going the way it's supposed to go. Oh my gosh, and it's cheap. Like, what? Wow, that's good to know.
It's very good to know.
Like, we're not just talking about having a normal sex life. We're also talking about not dying from urosepsis or a slow decline in your kidneys. Like, this is cheap and easy. Like, I just want to rock into the nursing homes and be like, here's some vaginal cream. Everybody, here you go. Come and get it. Let's just pass it out. Like,
oh my goodness, that's amazing.
So,
I can see you doing that too. Just, here you go. One for you, one for you.
I know. Of course, the ones that are nonverbal and stuff, it's different for them that are out. But because somebody would need to be doing that for them, of course.
Yeah.
If we're going to prevent urosepsis, but this is a pretty big deal. Also, something that women they don't want to have urinary tract infections or yeast infections, and then they're embarrassed, like, what's going on? I'm constantly getting these. Something I'm doing wrong. You know, they feel ashamed and gross and whatever. And who knows how the husband's taking it, if they have a husband, you know.
They're probably taking it personal, like how I talked about at the beginning, because if there's not that communication, if there's not that space to talk about it openly, then there's going to be, there's just this wedge and barrier that's going to be driven between them because there's not that consistent communication, and someone's going to take it, they're both going to take it personal. I mean, we're talking about just healthier and happier homes later on in life. Like, that's like, no, like, and I think that's also why, because from a generational and cultural standpoint, you know, the younger generation is not getting married as young anymore because they see this rise in divorce rates. They see their parents separating. They see this division. And I think this could really encourage a lot of people that they're just talking about it, that this will naturally occur in life as far as menopause. And there's risks that with, you know, just health issues that are going to come if we don't, you know, have a roadmap, if we don't have a game plan for this. And you can plan for it. You can really be proactive and plan for it so that you're really setting yourselves up for success in the long run. And I really hope that, you know, people find this encouraging, because I feel encouraged. I feel equipped. I'm not even married. Imagine how the married people are feeling right now. They're just like, this is so good.
Yeah. Can you imagine? I mean, like I said, of course I can educate my husband very, very swiftly, but then he desires to want to make things smoother. You know, he's very loving. He's very, you know, he said, you deserve this. You deserve this. And even just hearing that as a woman, it's like, I do. Oh, I do. I do. Oh, I do. Oh, we don't even think of it that way. But if a significant other says that to you, like, yeah, you deserve for me to understand and be able to communicate with you on this. So we're living it together. This is it.
Mm-hmm.
This is
Yeah.
it. You know? I mean, we could, and we have these conversations too, and I don't know if this is too platonic for people or whatever, but like, okay, so this makes sense, right? A woman in the household, she's not feeling herself. She can't explain it to anybody, let alone understand it herself, right? And then, now the man's affected. So, what do you think a man would want to do? And he doesn't want to deal with it because he doesn't know how to deal with it. So
They
now
leave.
they're gonna leave. They're gonna do something that would really make their significant other mad. Whatever that is, they're gonna get a new fast car. They're gonna get a motorcycle. They're gonna have an affair. Whatever, right? They're gonna act out too because they want to feel good again. Because now they're not feeling good. So they're gonna find something to feel good. And even the old school folk stuff, yeah, find a younger girl because she doesn't have this problem yet. She seems simple at the moment.
Yeah.
Well, duh, right? All of
It's sad. Yeah.
those things kind of make sense now because it was never actually understood what was happening. If that's the issue, we all know there's many, many things going on. I'm
Yeah.
not giving anybody excuses. I'm just saying that maybe some of these actions might make sense.
Yes. Ultimately, I think that's the light bulb that's coming on for people is like, this could be, if not in their own lives, but in maybe their parents' lives, or because sometimes you just see the stress or you just see the discomfort, the just not being sure about what's going on, that uncertainty. So I think if anything, it just shed a lot of light onto a major event that's inevitably going to happen and how to talk about it and how to plan for it.
Yeah.
I think we did great today.
Yeah.
This is
know what time it is.
It's 11. It's 11 a.m. I do have a hard stop at 11. But just in closing, if anything comes up where people have questions, I will always refer them to you because, I mean, you're so well versed in all of this, and yeah, comment questions. I'll definitely. We need to do a series on on just what we touched on in our first podcast, and because I really like this deep dive into just menopause. I know we touched on even, I didn't even know that breast cancer could, be associated with early menopause or things like that, and just didn't really even dawn on me. You know what I mean? So I found this super helpful for me. I hope you guys found this super helpful. I mean, even if I was just doing this for me, I'd be like super stoked. But I really hope that this is encouraging to folks and really brings relationships together and really builds the family up because we need it in our culture today. So thanks so much for your time. Do you have anything in closing you wanted to say to anybody or any?
I'm just so grateful to be able to do this and with you and be able to do what I do. So I'm always available to talk to people. So anytime.
Awesome. Well, I hope you have a great weekend, and we'll be in touch soon, and we'll do another one. And I'm really excited to hear what people want us to talk about next, because this is where it starts with quality conversations like this, and you're the best. Thanks, Stacey.
Take care. Have a good one.
Bye.